Hello. Today we are going to discuss about the cough reflex and pharmacology of antitussives. First of all, we must be very clear about the definition of cough. Cough, or the medical term is tussive, is an action of short explosive expulsion of air from the respiratory passages. To put it simply, when any substance irritate the respiratory passages, cough happens. However, in certain cases, coughing may become excessive and non-productive, and is troublesome and potentially harmful to the airway mucosa. Otherwise, it is an important defensive mechanism that improves the removal of mucus and particles from the airways, and guards against the aspiration of foreign objects, and is important in lungs and airways. With the definition out of the way, the next thing to understand is the cough reflex. The cough reflex consists of three key elements, that is the afferent pathway, the cough center, and the efferent pathway. Let us first talk about the afferent pathway. When we see the upper airways, these are innervated with branches of vagus nerve. When the nerves are stimulated, impulse is generated and the impulse travels to the cough center, which is located in the higher brain stem and pons. The cough center then sends the impulse via the efferent pathway like the vagus, phrenic, and spinal motor neurons. These motor neurons carry cough center impulses to the diaphragm, abdominal wall, and muscles. These muscles then act in such a way to make cough possible. Now, we have understood the cough reflex, it is time to understand the mechanism of the action of cough itself. The action of cough itself is divided into three important phases, that are the inhalation phase, compression phase, and exhalation phase. The first phase to be considered is the inhalation phase. In the inhalation phase, massive inhalation happens. This is to generate enough volume to expel the irritants via cough. After the inhalation, we go to the compression phase. In the compression phase, the diaphragm, abdominal and muscles of chest wall contracts. This action is further helped by the closure of the larynx. All these actions will increase the intrathoracic pressure. The last phase is the exhalation phase. In the exhalation phase, few changes take place. First, the glottis opens, and this opening is the cause of high expiratory airflow and the coughing sound. The high flows dislodge mucus from the airways and allow removal from the tracheobronchial tree. This is the simple way where I remember the coughing reflex and the mechanism. If you are interested in the specifics and the details, I have linked the source below, you can take a look. Next, we need to understand how various antitussive and expectorants medication works. First of all, for productive cough that is producing sputum, we need to use expectorants. Why? Comment below if you know the answer. Likewise, in the case of non-productive cough where sputum is not produced, we need to use antitussives. Let us first discuss about the expectorants. An expectorant is used for productive cough, and it acts in such a way to make it easier to expectorate. You are required to know the examples of those expectorants, which are like potassium iodide and bromohexine. Bromohexine, for example, depolymerizes mucopolysaccharides in the sputum. This action makes the mucus to be less viscous and thus easily coughed out. In my hospital, we always use bromohexine to relieve productive cough. Potassium iodide, on the other hand, acts in ways to increase the bronchial secretions and makes the secretions voluminous and easily coughed out. However, you cannot use potassium iodide in pregnancies. Comment below if you know the reason why potassium iodide is contraindicated in pregnancy. Now, let us go to antitussives. Antitussives can only be used to treat dry cough. It is contraindicated in the treatment of productive cough. The examples of antitussives include codeine, dextromethorphan, and noscapine. Generally, antitussives acts by suppressing the cough either on the cough center or inhibiting the cough impulses traveling via the nerves. For example, codeine decreases the sensitivity of cough centers in the central nervous system to peripheral stimuli and decreases mucosal secretion, and dextromethorphan suppresses the response in the cough center. As usual, there are quiz questions. Pause this video and answer them. Comment your answers below. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.